So, good evening, everyone. Thank you very much for joining us. This is the first webinar of the year that AONM is holding, the Academy of Nutritional Medicine. We're absolutely delighted to have one of the greatest specialists on PANDAS in the world here with us today, Dr. Nancy O'Hara. She's going to speak about Demystifying PANDAS, a functional medicine guide on basal ganglia encephalitis, which is another term for the same thing. I'll just introduce her very briefly. Dr. O'Hara is a board-certified pediatrician who graduated with the highest honors from Bryn Mawr College and was a member there of the Alpha Omega Alpha Honor Society from the University of Pennsylvania School of Medicine. She also earned a master's degree in public health from the University of Pittsburgh. After residency, chief residency, and general pediatric fellowship at the University of Pittsburgh, Dr. O'Hara entered general private practice in 1993, and in 1998 she began her consultative integrative practice for children with special needs. And since then, she's dedicated her functional medicine practice to the integrative, holistic care of children with chronic illness and neurodevelopmental disorders, such as ADHD, OCD, Lyme, and PANDAS. She's also a leader in the training of clinicians, and she'll be talking to us about that, not just in the USA, but all over the world. And she has written a comprehensive guidebook on the subject called Demystifying PANDAS. So just to mention, please, that while she's speaking, do put any questions that come to mind in the chat box. Please focus on the chat today because she'll be helping to answer them herself by reading them at the end. And she has so much to say that she may go a little bit over time this time. So if you find you haven't got the time to stay for the full, maybe 1 hour and 20 minutes or so, then don't worry, the recording as well as the slides will be made available to us and will be up on the website within a few days. So with no further ado, Dr. O'Hara, over to you. Thank you so much for being here. We're very honored.
No, thank you for inviting me, and so glad to do it. And welcome, everybody. I am a tad verbose, so I'll try to get this as much through as much and give you as much information as I can. I always like to start with this particular quote, though: follow those who seek the truth, but flee from those who have found it, because, you know, we all go through this. You know, I got into this because my own son developed seizure-like tics after getting a strep infection, getting bit by a Lyme positive tick, and also having a viral trigger. So I've been there as a parent, not just as a professional, and I know what obstacles we all meet. And this is a very, unfortunately, controversial problem. Sue Sweeto and 30 other clinicians tried to make it less controversial. Sydenham's chorea was the prototype. PANDAS, she coined that phrase. And, you know, if she had a little bit bigger ego, it would probably be the Sweeto disease, and we wouldn't have all this controversy. But then included other microbes, including Lyme and Lyme co-infections, mycoplasma, viruses, mold, and other triggers, all to be abrupt onset. I'm going to go through these first few slides very quickly because I really want to focus on treatment and treatments that you can all do without prescription, et cetera. So I wanted to include this, though, because COVID is definitely one of those viruses that can induce a post-acute infection syndrome. In our practice, 42% of children have Bartonella, and 41% of the ticks in our area in the Northeast United States carry Babesia, but it's in England. It's everywhere. So don't forget about this. And this is an autoimmune disease. It's a combination of genetics loads the gun, environment pulls the trigger, and it's the interaction of the gut and the microbiome and the immune system, all of which combine to be healthy, a good clinical outcome, or disease, which most of our kids are going through. So by definition, it's an abrupt or dramatic onset or recurrence of OCD. However, sometimes the initial presentation was at a much younger age, like 2 or 3, and got treated very quickly. So later at age 8 or 9 or 17, it can be much more subacute. Also, Lyme and mold are more subacute in their presentations. It can also, in 20% of children, be an OCD-like restrictive eating disorder. And then 2 of these, and you guys live it. It's emotional ability, that 0 to 60, the baby talk, the handwriting deterioration. That's a sine qua non for this disease. And if you have one of those top ones here, together with a somatic symptoms like abrupt onset of bedwetting or an abrupt onset of sleep problems, then that may well be part of this diagnosis. And I learn in pictures, so I always include a lot of pictures in what I do. Handwriting deterioration in 90%, urinary symptoms in 90%. The kids that end up in psych hospitals are presenting with psychosis and hallucinations. That's only 10%, but that's still part of this disease. And almost all of them look like they have that deer in the headlights look, that hyper alert appearance. So what's the differential diagnosis? Certainly Sydenham's chorea, which is the neuropsychiatric form of acute rheumatic fever. Other forms of vasculitis, encephalitis, toxic medications, overdoses, abuse certainly. But Tourette's and OCD are not of abrupt onset. So if you have abrupt onset, it's not that. And neuroinflammation is in about 80%. Now, I know this is a very old picture. There's many other studies since then that have proven that, but I like the picture. You can see the inflammation, the purpleness with Sydenham's chorea and PANDAS. But in kids with Tourette's or OCD, they're just like the neurotypical kids, no inflammation. So, and there are lots of other things you can see, and I'm just going to list them there. I'm not going to go through all of those. But again, in pictures, here's the handwriting deterioration. This is a 7-year-old in my practice, one day and then the next. So the triggers are strep. That's the classic. That's what PANDAS is. But it's not just strep in the throat. It could be strep in the sinuses or in the rectum. 20% of our children in our practice have a red anal ring. And if you culture that, it's positive for group A strep. It's about 7% in the literature. I don't know if I'm just looking more or they're actually missing it in the literature. Mycoplasma, often the kids aren't sick with it, but grandpa had pneumonia and they have the inflammatory reaction. Viruses, certainly COVID induced a lot. Monoviruses like EBV and CMV, herpes viruses with cold sores, etc., and many others. I cannot forget, and please do not forget about Borrelia or Bartonella and Babesia. I missed Bartonella in my son, so it's one of my passions. Yeast and mold, certainly, anesthesia, chemicals, pesticides, and there's usually a history of autoimmune disorder, either in that child or in a first-degree relative, sometimes Hashimoto's thyroiditis, sometimes diabetes, sometimes gut dysfunction, inflammatory bowel disease. But then there's some type of prodrome, some type of illness 2 weeks, 6 weeks, 3 months before the onset. And it's usually around 6 weeks, but that's what I'm looking for. So with group A strep, there's a lot of information there. I'm not going to go through it all. With mycoplasma, there are tons of studies that show that it indeed causes problems in the basal ganglia. And that even with just chronic positivity, you can see worsening in tics. So that's, again, treating the immune system, and not just steroids and IVIG. There's a lot else we can do. And I'm always looking for silver linings in everything we do. But with COVID, there were very few silver linings. But one is that maybe a couple more practitioners saw that there were infection-related neuropsychiatric problems that developed. We see it. So especially if they get worse after COVID, don't think just about COVID. Think about reactivation of mono, like EBV or CMV, and especially reactivation of Lyme or Lyme co-infections. Now, we know all the symptoms with Lyme usually, and children can have any one of these, but the biggest symptoms with kids when they have chronic Lyme disease is brain fog, anxiety and depression, and cognitive impairments. So if your child has those, you should be looking for borreliosis. And as you know, Armin Labs is one of the best places to use to test for that. And, you know, this isn't new information. We've known about Lyme causing neuropsychiatric problems for decades. This study is from 1998, but we're still seeing it over and over again. And then Bartonella, again, some of that brain fog. You can see migratory neuropathy and fasciculation. So you may feel like little tremors under the skin, or the kids may say, I'm feeling antsy. That could be Bartonella. But especially if they don't have the typical waxing and waning course that most kids with PANS and PANDAS have, if it's a constant daily flare, especially with rage or aggression, think about Bartonella. And then foot and heel pain, sometimes rolling up their socks in the bottom of their shoes if they don't express it. And then the striae. The striae do not follow dermal lines, so they're either horizontal or vertical, not following the skin lines. And they can be on the back, that's a typical place, but they can also be on the forehead or the neck. I've seen them on the knee. And they blanch. The color changes when you press on them. So that's different than stretch marks from weight changes or from adrenal stress. And again, lots of research that Bartonella causes this. Babesiosis, it's really climbing in this area of the country, of the US. But what's really fascinating, and you can't even test for this one, but it is present in humans, Babesia oticoli doesn't present as an acute disease, meaning with babesiosis, what the CDC and your governing bodies in the UK say, babesiosis causes anemia and fever, and that's about it. Babesia oticoli doesn't cause those. It goes straight to neuropsychiatric symptoms. So when I see a kid, particularly with night sweats, they're sweating all over the place, the sheets are wet, with air hunger with their anxiety, with GI symptoms with their anxiety, and with unrelenting headaches or a lot of dysautonomia, the dysregulation of the automatic nervous system, I'm thinking about babesiosis. And then I also look for mold. I look for chemical exposures. I look at mineral levels like zinc and magnesium. I look at metabolic markers like glucose and sometimes lipid profiles, et cetera. I look at antioxidants like vitamin D and vitamin A. I may look at the mitochondria, which will be secondarily affected. And I look at other antibodies. Folate receptor antibodies is done by a company called Religion, is available in the UK. And we just published yesterday a study on folate, cerebral brain folate deficiency in children with PANS and PANDAS. It's been known in children with autism, but 60% of the children in our practice with PANS and PANDAS also have cerebral folate deficiency. And what does that cause? Anxiety, brain fog, OCD, tics. And so finding that and also treating that can be very helpful. We'll post about that online and on my website later. And then mold. Mold, the biggest symptoms are electric shock sensations, pulsing or vibrating sensations, ice pick sensations, especially down the spine. But it can also be memory problems, fatigue, brain fog, you know, pretty much any symptom can be mold. And in this area of the US, it's very common. And it's very common in several of your areas also. So we look at all of that. We look at what's going on in the child's gut, what medications they may be on, what infections they may have, what other stressors are going on in their life, what's their diet like, and look at all of that to put it together. And that's why we need a team. You know, we have a dietitian, a naturopath, a therapist, lots of people working together to help our kids. So what's the background? What's going on? So let's take strep as an example. Your strep infection, let's say it's in the throat. Not every kid with strep throat gets PANDAS. you have to have that genetic susceptibility, the HLA-B alleles. And then what happens is the antibodies that should be attacking the strep in the throat instead cross the blood-brain barrier and attack the basal ganglia. That's called molecular mimicry, or a misdirected immune response. And that's where you get the symptoms. There's a wonderful webinar by Dr. Aguilar that looks at why our blood-brain barriers are leakier. Just like our guts are leaky, in this toxic world, our blood-brain barriers are leaky. And that's why we're seeing PANS and PANDAS in older kids too, and even in adults when it's misdiagnosed, mistreated, or, they have Lyme or mold later in life. There's lots of evidence. I'm not going to go through all of this. The research is there. There's lots of evidence that this exists. But for me, it's about the child in front of me and that child's response to immune modulatory therapy. What's the most important biomarker? I always get this. What test can I do? The most important biomarker, say it all together, is history. It's not about, is the strep titer positive or the mycoplasma positive? It is about history. This is detective work. And the earlier we can diagnose these kids, and that's what this study shows, the more likely they are to get better. So that's why I'm spending so much time trying to train more people. All right, what may we see on physical exam? Choreiform movements are something you can do at home or in your office. You have the child stand with their feet together. They put their arms outstretched and their fingers outstretched. So they're like this, and they shut their eyes. So arms stretched out, elbows locked, fingers outstretched, shut their eyes, and see how long they can hold steady with their fingers. They should be able to hold steady for 30 to 60 seconds, even if they're lecturing. No. But if they start playing the piano with their fingers or supinating their hands, that's a sign of choreiform movements, and that's pathognomonic for basal ganglia encephalitis, or the immune system attacking that part of the brain that causes anxiety, tics, and OCD. You may also see that red anal ring that I talked about, the peeling fingers, and about 10%, about 6 weeks after a strep infection, the tongue. Now, this is a yeasty tongue with the white plaquiness, but there's also raised papillae. That's the strawberry tongue. That's a sign of strep. You may have a throat with palatal petechiae, swelling, etc., but you may not. It may look totally normal. If your child has an abrupt onset, get the culture. And then sometimes they even have the Jones criteria, like in rheumatic fever and damaged nail bed vasculature and other things like that. With Lyme, you may see a classic bullseye rash, but you only see it in definitely less than 50%. And many times, some research shows as little as 20% of kids. It may look like this in hairy areas or like almost like a bruise. And this is a patient of mine who was sent to Children and Family Services for abuse. This is in his groin. And I remember I was in the Denver airport and she sent me this picture on my phone and I said, that's not abuse, that's Lyme. And the next day it looked more like a classic erythema migraines rash. And then again, the usual striae, blanching, thick, with Bartonella. You may have the whiteness on the tongue with yeast. You may have a positive Woods lamp, and always check the sinuses because often there's sinusitis in these kids too. So history and physical exam, abrupt onset or subacute onset with abrupt onset earlier, choreiform movements and evidence of infection. Culture possible sites, culture the nares, culture the throat, culture the rectum if it looks red. And if a child has a tonsil nadoidectomy, culture the inside because it looks very different when there's PANDAS. There's more inflammatory markers and different bacteria on the surface than there are in the core, and it may change your management. And the laboratory evidence, do not treat titers. The most important and most commonly positive is an ANA, an anti-nuclear antibody. In our practice, it's about 60% of kids. It's about 56% in the literature. And then we do strep markers, the ASO and the anti-DNase-B, but if you're testing it too early, they may be negative. And 40% of children with documented group A strep, not just PANS or PANDAS, all with documented group A strep do not show a rise in titers ever. That's because there's immune dysregulation and in many of our kids, immunodeficiency. So positive titers don't mean PANDAS and negative titers don't mean there's not PANDAS. Other infectious markers you may want to consider, depending on the history, are the mycoplasma, the Borrelia, Bartonella, and Babesia, maybe viral markers, maybe yeast, Clostridia, or parasites, all of which can cause it. And then I know you also have the Cunningham panel. I do this because it is expensive when a child is in a flare and when there is an atypical case and I have to prove to someone, the parents, another practitioner, that this is really going on. But it really is distinct. When you have a high chem kinase, which is a calcium modulated protein, you're going to see elevations with Sydenham's chorea and with PANDAS, but not with kids with OCD, tics, ADHD, or neurotypical kids for other reasons. Yeah, there's a little bit of overlap here, but if you've got a number over 150, it's pathognomonic for this disease. Now, let's get to the meat of the matter. I did that pretty fast, so I think we'll have plenty of time. It's a three-pronged approach always. You've got to have all three of these in. You've got to treat the symptoms. And I always treat the symptoms that are most pressing for the family. Is nobody in the house sleeping? Then I'll treat sleep first. Is the kid constipated out the yin yang? I treat that first. Is the kid got tics or OCD? What's the most pressing symptom? Sometimes there are psychoactive medications that we will use, but there are so many nutraceuticals that are helpful and therapy. I started my life as a teacher. I was a really lousy teacher, so I took the easier road and went to medical school. I firmly believe that was easier. But I believe in therapy, particularly cognitive behavioral or CBT or DBT. You need to remove the source of inflammation. That's treating with antimicrobials, but there are lots of wonderful herbs. And then absolutely you need to treat the inflammation, that raging fire, with immune modulatory interventions. But that doesn't mean just steroids or IVIG. There are a lot of other ones. So here's the biggest symptoms: OCD, anxiety, tics, aggression and irritability, sleep problems, eating disorders. So let's dive into them. When it's OCD, certainly you can use SSRIs, your sertraline, your, lots of different ones. I know all the brand names rather than generic names, so I'm not going to go through all of them. But if a child comes to me with that, or if a psychiatrist really wants to add that, I try to add it at the very, very lowest dose, because often children can do well with a very low dose. But I much prefer nutraceuticals. N-acetylcysteine is a wonderful nutraceutical. It has 17 studies that show improvement in OCD, including skin picking, trichotillomania, which is hair pulling, gambling, hoarding, all types of things. Couple of things about NAC is it should be in a individually blister packed source. And if you get it in a big bottle, take each daily dose and put it in a little Ziploc or a blister packed bag so that you're not oxidizing it every time you open the bottle. Herbal adaptogens I love. Ashwagandha is the herbal Valium, comparable to Prozac. Rhodiola, holy basil, many, many others. Inositol, the biggest mistake we make with inositol is not giving enough. The studies were up to 18 grams. That's 5 teaspoons of the powder. Good news is it tastes good, but if you're going to use it, you've got to get to that dose. Hemp oil, CBD, is a great anti-inflammatory and also shown to decrease OCD and anxiety. I really only use CBD. I do not use THC because I have seen several kids with an onset of psychosis after using full spectrum or THC with the CBD. Lithium orotate, I direct you to a lot of information from Dr. Greenblatt. He's written whole books on lithium orotate, and it can be very helpful, especially for those kids who seem almost bipolarish. But it's a very safe supplement. I'm not talking about lithium, the medicine, and at 5 to 10 milligrams. GABA is an anti-excitotoxin. It modulates glutamate. Giving it with theanine or in a formulation that has better blood-brain barrier penetration really helps. And it can be very good for both anxiety and OCD. And I'm a big believer in natural ways. You know, kids can do mindfulness and mantras. They may be singing Frozen for, Let It Go from Frozen. They may be walking. They may be doing any type of exercise, breathing techniques. Anything will help these kids, and helping them to do it also may help you as a parent or as a practitioner. I take a lot of deep breaths, and it's really helpful. I'm also a big believer in Wim Hof, which is that, you've seen a lot about cold plunges and saunas, that hot cold and all of the things we need to do naturally to decrease all of our stress. Good eating, good sleeping, good pooping, good peeing, good sweating are all really important. And then anxiety. There certainly are a lot of medications. And if I need to, I will use them. I'll talk about amantadine, which is one of my favorites a little bit more. But there are many, many nutraceuticals you can use. 5-HTP is a precursor to serotonin. And it can be very safe as long as the child is not on an SSRI. You can get serotonin syndrome, so you don't want to use it if they're on an SSRI or an SNRI. But 5-HTP is very safe. Magnesium, I talk about it a lot with tics, but it's also very good for anxiety. It's also good for constipation, and just stress in general. I use magnesium citrate or oxide when they're constipated. I use magnesium threonate or glycinate when they have anxiety or brain fog or ADD. And I use magnesium aspartate a little bit more, but also threonate when they have tics. B6 increases GABA and can be very helpful. Just watch. I use that one a little bit later often because B vitamins can exacerbate, they're made in a fermenting process, and they can exacerbate yeast and mold. Lemon balm, wonderful antiviral, calming, can be very helpful. Saffron, lavender, and then methyl tetrahydrofolate. Remember, if they have that mother, your audio didn't go out. I just can't swear on a recorded thing. But if they have that genetic mutation or they have cerebral folate deficiency, methyl tetrahydrofolate as a supplement can be very helpful in decreasing their anxiety. Again, with any of these, start low and build up slowly. And then, of course, as I said, I'm a big believer in therapy. Tics. Again, anything that I talked about that works for anxiety and OCD may well work for tics. And then my favorite, as I said, is magnesium. Citrate or oxide with constipation, glycinate or threonate with brain fog, tics, anxiety, OCD, etc. If you can't get your kid to take anything, Epsom salts baths, magnesium salt creams can be great ways to get it in through the skin. There are several pharmaceuticals, and I'm not going to go through all of these. This one's $10,000 a month. Yay. There are some, like these second-generation anticonvulsants, that work very well. But I usually go to all of the nutraceuticals first. And then one thing I wanted to mention, I'm a big believer in physical medicine, good massage, good craniosacral, good chiropractic, acupuncture. Again, diet, an anti-inflammatory diet, exercise, meditation, and then counter tics. If a kid has vocal tics, getting them to hum or chew gum can decrease that. If they have motor tics, playing with a widget in their pockets can be helpful, or learning how to drum can be helpful. And then sleep problems. These kids, the sleep problems are REM disinhibition. That's problems with restlessness, moving all over the place, not getting into deep restorative REM sleep. And I will treat that first if that's a problem. Melatonin, if they're having trouble getting to sleep, 5-HTP, magnesium, GABA and theanine, valerian root, if they're having trouble staying asleep. And also looking at cortisol, because we should have our highest cortisol in the morning, but often it's much higher later. And we're not seeing the melatonin rise as we need to. So keep that in mind. With kids with restrictive eating disorders, most of them are zinc deficient. If you can measure this, measure a red blood cell zinc or RBC zinc. If you can't get that, get a plasma zinc. Much more accurate RBC and secondarily plasma than serum. But many people with restrictive eating disorders are zinc deficient. They also need more protein and more oils. MCT oil is medium chain triglyceride oil and helps to increase fat. And then bitters to help with digestion, particularly ginger. Kids with zinc deficiency will have multiple white spots, lines on their nails. They may have little aphthous ulcers, also sparse hair, and it also exacerbates that keratosis or chicken skin we see with kids with essential fatty acid deficiency. And Emerson didn't mean the gut when he said what lies behind us and what lies before us are small matters compared to what lies within us, but I do. And so diet is very important. Now, it really is just getting more protein, more oils, more veggies, more food, less processed foods into our kids. The more you can do that, the better. Now, the kids with restricting eating disorders, I tiptoe my way into this. Maybe adding some protein powder or things like that. But it all disease starts with the gut. It's not the second brain, it's the first brain. All right, antibiotics. Often I will start with azithromycin because I see a lot of Lyme, Bartonella, and Babesia. It's a first line for each of that. In our area, Strep is sensitive to it, Mycoplasma is sensitive to it, and it has immunomodulatory properties as well as antimicrobial properties. So if I'm not sure what germ I'm dealing with, I may start with that one. If you have the ability to order antibiotics and you do use it and you use it for more than a few days, which I recommend, you really want to get an EKG because there is one article that shows prolonged QT intervals with azithromycin. So you want to prevent that. You don't want to use azithromycin if they already have that. I've had thousands of EKGs. I've only seen it once. If I'm going to use antibiotics, my second choice is Ceftonir, but I really use a lot of herbs. And especially if your child got better with antibiotics and then nobody will prescribe anymore, use herbs because they really need to be prophylaxed to prevent the second, third, fourth iteration of this disease. So when you prophylax with penicillin, if you miss one dose, you're not protected for 3 days. Azithromycin, you can wean down to as little as 1 dose per week. But what I really do is wean off the azithromycin and then I add the herbs. My favorite herbs are Usnea, which is a wonderful herb with activity against strep, Tega, which is a pine needle extract from the Siberian forest. You can get that in the UK. It has wonderful antimicrobial activities. Berberine, especially in the form of golden seal, is very helpful. Oil of oregano is great for yeast, some forms of Lyme, as well as strep. So that's one of my favorites. And neem also. And what I usually do is I start out rotating 3 herbs. So I may use Tega for a couple weeks, then berberine for a couple weeks, then oregano for a couple weeks, and then I'll go back to the first one. And I may continue this rotation for a year. But let's say a child gets better and is really doing well with oregano or oregano, you guys may say it, but anyway, I like the way you say things better than I do. But if you do well on oregano and berberine, but not so well on Tega, take the Tega out and just rotate the berberine and the oregano. But you should rotate at least 2 and not stay on the same herb all the time. those are my favorites. There are a lot of others, but those are my favorites. For mycoplasma, as I said, I usually use azithromycin first, but again, berberine is very good. Hatunia is one of my favorites. Izatis is very good. Colloidal silver is very good for strep, very safe in the forms that I use. And I'll get to that in a minute, as well as, being safe for and helpful for mycoplasma. I also like a rotation, and this is what I do a lot now, of cat's claw and capsiandra. I'll start with 1 drop and increase by 1 drop per day to the maximum dose for a child's weight. And I'll talk about how we do that. And I do that for 2 weeks, take a day and a half off, and then I alternate with a toba bark and stevia, increase up over 2 weeks, and then take a day and a half off, and then go back to the cat's claw and capsiandra. That works very well for mycoplasma. This picture is to remind me that most children with mycoplasma-induced PANS do not have any illness. They didn't have this type of rash. That's very rare. They didn't have bronchitis or pneumonia, but they had somebody in the family that was sick with mycoplasma. And then viruses. Here's where you really need to use antioxidants, herbals. One of my favorites is vitamin A. I do like to get a level because I like to use high doses. And if the vitamin A is low, the high dose is very helpful in many kids and protective against COVID. It's been studied against measles encephalitis and many other viral encephalitides. Vitamin D, 90+% of kids in our practice are vitamin D deficient. 80% of kids with PANS and PANDAS are deficient. And vitamin D is great for mood, autoimmune disease, as well as it is an antiviral. So they really need to have a good level of vitamin D. I like vitamin C when they get a virus. I don't use it all the time because it can be stimulating in a good way, but also stimulating increasing anxiety or OCD. So watch that in your kids. Lysine is a wonderful amino acid that has antiviral properties, and monolaurin is, again, one of my favorites. I have a particular monolaurin that I can talk about in the question and answer period if you want to ask about it, with monolaurin and a biofilm buster together. It's in a gel that works really, really well. That's one of my favorites. It's antiviral, antifungal, and anti-Lyme. Olive leaf extract and lemon balm, again, great herbs for viruses. And we have an acute viral protocol that's starting higher doses of vitamin A, vitamin D, zinc, and lysine at the onset of any viral illness to try to prevent flares with viruses. And then amantadine, which, as I had mentioned back with anxiety, is the only medication I use with viruses. It has good antiviral, anti-inflammatory properties, but it's a medication that's been used for decades for Parkinson's, so it really can decrease OCD, that getting stuckness. This is a child in my practice. This was one day and then the next. And then what I did was one immunomodulatory therapy, which I'll mention to you in a minute, and he went back to this. So we'll talk about that. What about Lyme? Lyme is very hard to treat with antibiotics, and you need multiple antibiotics to get the cystic persister phase, the cell wall phase, the intracellular phase. And it doesn't just take weeks or months, it can even be longer. They need to be symptom-free for 2 months. So the minimum usually is 3 months, but with a lot of the co-infections, it's 6 to 9 months. And it may require multiple courses of treatments, and you may have to break up the biofilm because these germs, particularly Bartonella, like to hide. So there's multiple studies showing the role of herbals with this. This is just one of them, and Cryptolepis is one of those herbs of many. There's Artemisia, skullcap, Japanese knotweed, Ocornia, and many, many others that have been well tested to treat Lyme and Lyme co-infections. So these are some of my favorites. Artemisia or artemisinin is very good, especially if your child gets worse around the moon cycles. these germs can be housed deep within tissues or even within parasites and come out when the parasites proliferate around the moon cycles. So artemisinin, I may pulse at that time. Grapefruit seed extract is very good. Stevia is one of my favorites, and I'll talk about that more in a minute. Cat's claw, Japanese knotweed, which is the active ingredient of resveratrol, which you get when you drink your red wine. So, keep having your glass while you're there. It's only 2:00 here, so I can't have mine. Berberine also, and Cryptolepis. But these are my favorites. For Borrelia, I will use a 2-week course of cat's claw, stevia, and otoba bark. Take a day and a half off and then replace the otoba bark with capsiandra and continue the cat's claw and the stevia. Take a day and a half off after 2 weeks and then go back to the first. And the dosing is by weight. So when a child that's over 100 pounds, 120 pounds, 150 pounds, I will go up to at least 30 drops a day, sometimes 60. A child that's 75 pounds, and sorry, I should be saying kilos, but you do the math. It's 75 pounds, I may go up to 15. So base it on weight. That's called Clark's rule. With Bartonella, I may start with Japanese knotweed, but one of my favorites has become Hatunia with Capsiandra and adding stevia. Stevia really breaks up those biofilms and that persister or cystic form of Borrelia and Bartonella that is present. And then if that doesn't help enough, I may add Cryptolepis for Bartonella. With Babesia, a lot of times I am starting with azithromycin and atovaquone for a week, but my favorite is really Cryptolepis and cat's claw. And I'll use both of those together. And then, as I said, pulsing in Artemisia or artemisinin around the new and full moons. So it's about putting it all together. And the biggest piece of this is immune modulatory interventions that are not steroids and IVIG. So probiotics and prebiotics are really important. I am not one of those people that think that strep species in probiotics causes PANDAS. About 10% of kids will get worse, but there are wonderful strep species that are not group A strep, like Strep salivarius, that actually decrease the strep in the mouth, especially for our kids that have mouth apparatus or braces or losing a lot of teeth. So probiotics and prebiotics. Saccharomyces boulardii is a yeast against yeast from the skin of the lychee fruit that is very helpful in treating Clostridia, yeast, and providing immune support to the gut. Essential fatty acids are just that, essential. And if your child's not eating enough sardines, then add a supplement. And if your child doesn't have oil in their stool or easy bruisability with essential fatty acids, it's very safe to increase them as long as it's just the essential fatty acid, the omega-3s, and maybe a little bit of omega-6s. Aloe, especially if they're constipated, again, one of my favorites with very good antioxidant and anti-inflammatory properties. Curcumin, the active ingredient in the spice turmeric in a good bioavailable form, is very helpful. And I have a form of turmeric that I can give 10 drops every hour to nip the flare in the bud. And I'll talk about that at the end. And then SPM is specialized pro-resolving mediators. That's been very helpful in our kids with COVID to withstand immune and physical challenges. It is a gel cap, so it's hard if kids don't swallow pills. These others are either capsules or liquids, but it really is very good in helping our kids stay healthy as well as decreasing inflammation when they get sick. Ibuprofen is one that if you're not sure if a child is having a flare in behaviors due to, an infectious trigger, give 10 milligrams per kilogram of ibuprofen. And if they improve, it decreases the severity, intensity, or frequency of the flare, then that proves that there's some amount of inflammation involved somewhere, usually in the brain. So 10 milligrams per kilogram, often we're underdosing that. CBD, as I mentioned before, And then mast cell activation. Now, mast cell activation is something that's supposed to happen when we get sick. Mast cells are part of our normal immune response, but often that immune response goes wild and then we get mast cell overactivation or mast cell mediated disorders. There are a lot of prescription antihistamines that may be very helpful, but also bioflavonoids, particularly quercetin of high purity, may be very helpful in decreasing mast cell activation. And then steroids. Steroids may be helpful, but it's a temporary fix. As soon as the kids go off of it and it's only a short burst, they may get worse. And if they get worse even when they're on it, I always think about yeast overgrowth, Clostridial overgrowth, or Bartonella. Those can get worse when you go on steroids. So what I like to use and is available right in the UK is Helminth therapy. There's a lot of research into it. This is the company in the UK. Please go to their website and look up more information. Again, you'll start low and increase slowly. These are mutualists. The helminths that are available there are called HDCs, Hymenalepis diminutus cysticercoids. I'm not spelling that for any of you, but it's HDCs. These are grain beetle worm eggs, but they are mutualists, not parasites. They induce immune tolerance. They decrease autoimmune reactivity. And you give a small vial once every 2 to 3 weeks to induce that immune tolerance. But it's something that evolutionarily we've all had. When we used to dry our grains in large vats, we were all eating grain beetles and grain beetle worm eggs. And I often say, if you go into my mother's closet, and God bless her, she passed away almost 2 years ago now, but everything was so old, there were a lot of grain beetle worm eggs in her cupboard, but it's natural for us to eat it. And it goes through our system and we excrete it as long as we're not constipated or on any immune suppressing medications. And I don't like to use it in kids that are nonverbal and already have gut problems, because if the egg hatches, you will get some crampiness, very rare. I've seen it once when I missed it. And otherwise, if the kid has any cramping, I stop that intervention and give an anti-inflammatory and antihistamine, and it goes right away. But they are not replicating or causing infection or even infestation in your kids. So I can give a whole lecture just on that, but we'll stop there. IVIG is very hard to get in this country, and I know it's very hard to get where you guys are. But if you do get it, make sure it is in the autoimmune dosing of 1.5 to 2 grams per kilo. Lower dosages can make these kids worse. And it's not one and done, it's at least 6 courses. And then plasmapheresis, rituximab, I can literally count on one hand in the last 30 years the number of kids that have had that. I really get a lot of kids better with all of those nutraceuticals and herbals I mentioned earlier, and with Helminth therapy. And only 20% of the kids in our practice have to go to IVIG, and a handful get plasmapheresis or monoclonal antibodies. Adenoid and tonsillectomy is not for everybody. I have done a lot of research on this, and only in the kids that have sleep apnea or frequent strep infections or really enlarged tonsils and adenoids, those kids may well improve. Kids that don't have that, if you remove them, they may get worse. Vitamin D I mentioned, ibuprofen I mentioned. When we're under stress, we're acidic, so alkalinizing is really important. Xylitol is a wonderful natural sweetener that's also antimicrobial, and spraying that when kids have braces or into their nose when they have a sinus infection can be very helpful. And then I mentioned the probiotics like Strep salivarius. That's very helpful in decreasing the strep in the nose and the throat. And I highly recommend that. It's hard. It's a lot of stuff, but you can do it, and these kids can get better. So I wanted to give you this information. It's always one step at a time, one child at a time. My mentoring is open to anyone who is wanting to do it, parents and practitioners. You go to my website and you sign the consents, and it tells you everything you do. And we set up an hour-long mentoring session. And you can book it on the calendar right there. And there's an email address if you're having any problems. So we could do that. There's also a membership, which is at your own time. So if I've been doing this too fast or you want a lot more detail, I do have a discount code for everybody that's here at the conference. So you will get a discount. You just email Shannon for that. There are 30 videos on it now, and I'm adding 40 more this year. One just got dropped yesterday, which was how I assess new patients. There are 6 longer lectures that you can do at your own pace. Every month, we have live and recorded teachings on different topics. Last month, we did Bartonella. The month before, we did Hellman therapy. So those are all available and in our archives. There's a resource section with all the herbal dosing, a ton of articles you can take to your practitioner. And then there's access to my line. I did form a line of supplements, and a lot of those ones I mentioned, not all of them, but about 25 are on my OHMC. And I named it that for several reasons. One, it is my husband and my name, O'Hara McCabe. It also OHM is a mechanical term for meeting resistance. And we all meet resistance when we talk about PANS and PANDAS. And then OM is also that universal sign of meditation and calming down our anxiety and OCD. And then it stands for options for healing modalities and care. So that is available if you become a mentor, a mentee with me, or a member. And Shannon would give you that information. So wrapping it up, and then we'll go to questions. It's a clinical diagnosis, confirmed or not, by laboratory evidence. Complete history and physical exam is important. Blood testing of these things is really important. And the immune markers are the most important, looking for both inflammation as well as immunodeficiency. These are all available from a conventional lab. You can do a urinic acid at conventional lab, looking for metabolic abnormalities, mitochondrial markers, metabolic markers, antioxidant markers. Neuropsych testing may be helpful if you have somebody who's trained in doing it and looking for the clues with kids with PANS and PANDAS. And I very rarely ever do any additional testing, except as mentioned, sometimes an EKG or a sleep study. But I use my treatment as a diagnostic tool: diet, emotional supports, therapy, immunotherapy, antimicrobials, anti-inflammatories, very rarely steroids, but I put that one in there. These are all the faces of PANS and PANDAS: the kids with eating disorders, the kids that aren't sleeping at night and sleep during the day, the kids with separation anxiety, handwriting deterioration, OCD, rage, abrupt onset of ADD. Your child may have all of these, they may have one of them, but this is treatable. So it's a clinical diagnosis. Don't forget about Bartonella, Borrelia, Babesia, and others. Don't forget about the 3-pronged approach: symptoms, antimicrobials, immune modulatory agents, and everybody needs to partner together. We cannot blame the child. I always say the most important instrument in my office is a tissue box. So Emerson also said, do not go where the path may lead, go instead where there is no path and leave a trail. This is my website, the person you can email, and some other links, and then my book if you'd like to purchase that from Amazon or from my website. So anyway, I'm going to stop sharing now so I can see all your questions and you can see me. So we'll go to the top.
Yeah, absolutely stunning, Dr. O'Hara. Thank you so much. That was fantastic. I can ask the questions to start with, if you like.
Absolutely.
Just to mention, because a couple of people either joined late or didn't hear right at the beginning, the recording and the slides will be made available on our website under past webinars within the next few days. So don't worry. And also, just to mention, in case you do have to leave early, and we will do questions for another 15 minutes, Dr. O'Hara has kindly said that she will come back again at some point during the year and answer the questions that haven't been answered, because there are a huge number, as we expected. So going to the chat now, starting from the top in no particular order, because many have come in. Dr. O'Hara, can Lyme and co, that is Bartonella, Babesia, cause OCD and Tourette's, but not PANDAS? How would you?
Absolutely. Yeah. Those can be much more subacute or chronic. And technically, I wouldn't call it PANS. PANDAS, remember, is just strep. So PANS is everything else, but it can be not of abrupt onset. Absolutely. And, you know, in our practice, 42% have Bartonella. And we're seeing increases numbers of Babesia, but Bartonella and mold are the majority in our practice. A lot of what I call allopathic or Western medicine practitioners do not believe in Bartonella, chronic Lyme, babesiosis. So you won't hear that as much in the literature, but it's absolutely what we see in clinical practice.
Thank you. Well, I think you've answered the second part of that question. Do Bartonella and Borrelia cause majority of PP? I think there you'd said Bartonella and mold in your practice.
Yep.
Primarily. The factors that might predict children developing PANDAS, you said HLA-B?
That's not something that usually is done. It's more of a research proven genetic susceptibility. I think that our kids, you know, as a parent looking back at all the kids I've seen, a lot of these kids are kids that have just some sensory stuff before this. They may have a little bit of sort of an OCD tendency, or just want their clothes a certain way, or don't like loud sounds, you know, but nothing remarkable. And then those are the kids, I think, that are more susceptible to really develop this.
Okay, thank you. I think you mentioned that Babesia odocoili, which is new for us here to hear about, is not really testable. Is that true? Or is there a lab? One here has mentioned T labs that can test for it.
Yeah, most labs, including IGeneX, are not yet testing for it. They have found it in ticks, and because all the others are transmitted to humans, there is research in the literature and reports by the smart researchers more than me that it is definitely present within humans. So those testings will be coming. There isn't a good way to test for it. So if you have those symptoms or any other Babesia testing that's positive, I would definitely treat for it. And as I said, Cryptolepis is usually my first line, but then the others, as I mentioned in the slides.
Thank you. Another question that comes a bit later is that Armin Labs is good for testing Lyme, who's good for Bartonella and babesiosis. Just to mention that because AONM has represented Armin Labs in this country for over 10 years, it is excellent testing for Bartonella and babesiosis as well, particularly the T cell testing, that is the Ellie spots.
Right.
So
we now you may absolutely the sensitivity for Borrelia is very good. For Bartonella and babesiosis with Armin, the sensitivity is a little bit lower. So if you have a clinical picture that goes well with Bartonella or babesiosis, use your clinical judgment. Don't take a negative test, even from Armin, as the gold standard. So
absolutely, and the immunosuppression that you mentioned as well also needs to be taken into account, doesn't it? There is an interesting question here. Are doctors aware of how the striae of Bartonella present on darker skin? And second part, how do striae differ from stretch marks?
Striae is just, you know, doctors try to use big words to make themselves sound smarter. Striae are stretch marks. So, you know, they're really the same. But these are stretch marks in general are usually more horizontal, usually more following dermal lines, the skin lines, whereas these are either horizontal or vertical, or in some way do not follow dermal lines. So that's the first thing in a dark-skinned person. Also, they often look angrier, beefier, and there still can be blanching even in dark-skinned people. So I've seen that, and I have quite a few in my practice.
Okay, thank you. Another question here. What dose of NAC do you recommend for OCD in PANS, or does that depend on the child's weight, as you mentioned earlier?
The studies were on 1,800 to 2,700 milligrams. I usually start as low as 300 to 600 and build up slowly up to a maximum tolerated dose, or try to get at least to 1,800 even in a small child.
Mm-hmm. And is there any dosing that can be mentioned for ashwagandha, or is that very dependent on the patient? Because that is quite psychotropic, you explained.
Yeah. Again, ashwagandha comes as a liquid or as a pill. In the liquid, I usually start very low, as little as 5 drops, but will go up as high as 30 drops 4 times a day. But again, Clark's rule is what I use for herbals, which is the weight in pounds, and you can do the math, just multiply it by 2 with the kilos, weight in pounds divided by 150, and then times 30 to get the number of drops per day. For example, if your child's 75 pounds, that would be 15 drops. If your child's 150 pounds, that would be 30 drops. Now, often, if you're working with somebody, you can go even higher than that, but that's very safe if you're doing it on your own, to follow it by weight in that way.
Oh, thank you. There was a request to know the make of the monolaurin and biofilm gel that you said you might disclose.
Aqualaurin, AQUALAURIN, and it's aqualaurin.com. Eddie Spaghetti, and that's what he calls himself, will talk to you for an hour if you want to learn about it, but it has been a very good form of monolaurin for us.
Oh, wow. Thank you. One question here, whether you've ever used a pycnogenol?
I do. I like the Tega better. Both are from pine needle extracts, but if you can't get the Tega, and where I get that is australianvitamins.com. But if you can't, pycnogenol may be helpful. We did miss one question up top, if you don't mind, the folate question, if you don't mind if I answer that.
I was going to
sorry.
Together with the marker that is used for cerebral folate deficiency. Absolutely. If you could talk about that test a little more, because that's one that's not really used in the UK.
Right. And I'm not sure if you can get it, but you can definitely get MTHFR. And if a child has especially a C677 defect or a compound heterozygous defect, which is part A1298, part C677, then that's a child that may well have cerebral folate deficiency also. So at least get an MTHFR. Then the lab is Religen, REL, I think I, but it may be EGEN. And I don't know if they're available in the UK. I did not ask them before this lecture, but I can check for the future. That's a specialty lab that does a blood test. Looking at folate from a conventional lab is not accurate. Neither is B12 for that matter. That looks at extracellular folate and extracellular B12. What you're looking for is what's in the cell or in the brain. We don't have a good marker from conventional labs for what's in the cell or what's in the brain. The only way to measure it in the brain is either this test or spinal tap. And I'm not recommending a spinal tap.
But if someone's looking for a pointer as to whether to do that test or not, I think Ruth's question is good here. Might it be someone who shows up as deficient in folate in blood tests?
Not necessarily. They could have a very high folate level and still have it. Yes, they may be deficient, but again, if they're not getting, if it's not crossing, if the antibodies are blocking it at the blood-brain barrier, you may see very high levels out here in the blood because it never gets into the brain. So low levels, absolutely, but high levels still may well be necessary to treat for cerebral folate deficiency.
Fascinating, thank you. And cryptopyruria is another condition that does tend to come up quite a lot with this condition, it appears. Do you note that as well amongst your patient population?
Whenever a test is always positive, I stop doing the test. And every child I ever tested almost has a positive cryptopyrroles. And the main
Really?
treatment for it is zinc.
Mhm.
And so that here is a specialty test. I can't easily get it from my conventional lab that I use. So I'll just measure a zinc level. But absolutely, there's some good research by Bill Walsh and others showing that high cryptopyrroles can be coincident with neuropsychiatric conditions, and when treated can get better.
Okay, thank you. Relating to the cortisol that you showed us an interesting, very typical pattern of what commonly triggers an inverted cortisol pattern. And then
Well,
second part of the question, how do you reverse or reset it?
absolutely. So, especially in our children with autism, they're under a lot of stress just by the label that we've put on them and the things that they go through. And so in those children in particularly, there's often a reversed pattern. Their cortisol, they're always in a state of fight or flight. When you're in a state of fight or flight, your cortisol levels are high. And then when they finally pass out at the end of the night, it may go down. But those kids that are revving at night and really anxious at night, those are the kids that may well have high cortisol levels. Sometimes just using melatonin and some of the adaptogens or herbals that I mentioned, like valerian, passion flower, GABA, theanine, may help to bring down those cortisol levels. And then there are combination interventions. There's one called Cortisol Manager, for example, from Integrative Therapeutics that helps to decrease that nighttime cortisol. That's one that should be given before bed. I think the best thing we can do for cortisol levels is all the support of our automatic or autonomic nervous system. So good eating, good sleeping, exercise, sweating, the Wim Hof, cold, hot, the meditation, the breathing exercises, whether it's alternate nasal breathing or 8-4-1 breathing or whatever works, craniosacral, physical manipulation, chiropractic, all of these can really help much more, in my opinion, and definitely more than any medication, but much more than any nutraceutical.
Oh, fantastic. That was a very, very large number of interventions that we can use. I've noticed myself sometimes that if the autoimmune component is stronger than the active infection, that there can be issues with cat's claw. Have you noticed that it can't be tolerated sometimes? This
Sometimes,
is a
yes.
question here. Is there any advice if cat's claw can't be tolerated?
Again, it depends on which disease you're dealing with, because for Borrelia, Bartonella, or even Babesia, it differs which one you would put in, either Capsiandra, Atobabark, Stevia. I find, though, that many children can tolerate lower doses. So we're always trying to get to that 15 drops or 30 drops or much higher dosages. If we just stay low, we may be able, it may take us longer, but we may be able to tolerate it better.
Oh, thank you. And do you recommend using pharmaceuticals like antibiotics alongside herbs?
Yes.
I mean, we're talking about PANDAS here primarily, but this question was focused on Lyme and co.
Yes. Yes, I will.
Mhm.
Usually in an effort to get them off the antibiotics and keep increasing the herbs, but I will.
Okay. There is one quite long case here, which Ruth will get to a bit later if we have a chance to, otherwise maybe mention the next time. If IVIG is used and it helps, I think you mentioned that one needs to do it for at least 6 rounds in most cases, though I know that there are some mentions, particularly in the Cunningham panel pre and post. In the cases you've seen?
No, if one helps, that's great. Do one. But if 6 hasn't helped, 7's not going to help more. So, you know, it really is between 1 and 6 that children need. But I don't do IVIG. I don't want to make any money off of these big ticket items. So I refer out to our immunologist, and he will do 6 before saying yay or nay whether it's working. And that's really what the literature supports now.
That's fascinating, because I do know families who go on and will do 10 and more, and there need to be studies really on that kind of
absolutely
big ticket therapies, as you say. We sort of set it. Oh, it's now starting again. Great.
Great.
Is there a place for low-dose naltrexone in supporting immune modulation in this population?
Absolutely. Low-dose naltrexone is one I should have on there, and I'll work on it. But I have about 10% of kids that have sleep problems with it. But in general, low-dose naltrexone is another excellent anti-inflammatory immune modulating agent that should be done in very low doses, starting as low as 1 milligram or less, and going up to no more than 6 milligrams for low dose naltrexone. It's been used a lot in MS and AIDS and other autoimmune conditions that like PANS and PANDAS.
Yes, there are studies in the UK showing that it's useful in long COVID as well. It's being used in those kinds of conditions too. Is helminth therapy, which you talked about, so fascinating? Because I think a lot of people in the UK don't know about that yet, even though it's a UK-centered therapy. Is that okay to use with Lyme and Co, given it suppresses the immune system?
Yes. Now, I usually start herbs first, get that started. This is never an intervention I'm using at the first visit. But once they're on herbs and I've started to treat it, then I feel very comfortable adding helminth therapy.
Oh, great. And mentioning the low immune system again, if low immunoglobulins have been picked up, does that signify PANS, PANDAS, Lyme and Co, or can it be both?
Both.
Right.
40% of children with PANS, PANDAS can be immunodeficient, and it's more than that with Lyme and co-infections, but absolutely.
Yeah, fantastic. Thank you. Well, thanks everybody for all your questions. We will save all of them, including any further ones that have popped up in Q&A, and address them, and any others that come in with Dr. O'Hara the next time she's kind enough to spend time with us. Thank you so much. That was really absolutely fascinating and incredibly helpful. And I'm sure many of us will join your mentoring sessions and continue to take advantage of your huge expertise. Just to mention very briefly at the end that AUNM, the Academy of Nutritional Medicine, does represent the Cunningham panel and the brain autoimmune panel that they do, that's sometimes called the Cunningham panel. Also brain, the basal ganglia encephalopathy or encephalitis has been used for that. We will increasingly be calling it the brain autoimmune panel to make it simpler. And it is expensive, as Dr. O'Hara mentioned, but really has its place and can be extremely useful. So much more information about that on our website, or just email us at info@aunm.org. And we do also represent Armin Labs, which Dr. O'Hara did say is a very valuable laboratory for testing for Lyme and Co and viruses and many others as well. In fact, they're introducing a parasite panel using PCR alongside the antibody tests from blood that they already do. And so our next webinar will be about that in just a few weeks' time. So please watch out for that. Dr. O'Hara, can't thank you enough. Absolutely.
Thank you.
Fantastic. And thank all our listeners as well, and everybody who listens to this on the recording. Thank you, and look forward to seeing you again.
Great to join you. Thank you, everyone. See you again soon.
Bye-bye.
Bye-bye.
Thank you.